Please be advised, all music tracks used in this production are sole property of Kelsunn Communications and are original compositions. Thank you. To everyone tuning in, welcome. This is Silas, your e-journalism social work advocate. You're listening to the Kelsunn-on-the-Air social work podcast, the program that promotes, celebrates, uplifts, and highlights the social work profession. This podcast aims to educate the general public to the vital contributions professional social workers make in every aspect of society, every day. Hello, everyone. This is Silas, your e-journalism social work advocate, host of the award-winning Kelsunn-on-the-Air social work podcast, produced by Kelsunn Communications Incorporated. In October of 2020, I had the honor and privilege of being one of 15 social workers chosen nationally as the 2020-2021 Network for Social Work Management Policy Fellow. It was a 10-month research program. The culmination was a final presentation of each fellow's research findings. The series is entitled Raise the Wage, the Case for Equitable Pay for Social Workers and Other Human Service Professionals. Today, we have a very influential guest with us, and it is my distinct honor and pleasure to introduce and welcome Ms. Sarah Butts. She's an LCSW, and she is the Director of Public Policy at the National Association of Social Workers main headquarters down in Washington, D.C. Ms. Butts, thank you so much for joining us in this very, very important documentary feature.
Thank you for having me.
Okay, so we're gonna get right into the heart of the matter, and the whole purpose that I chose this particular topic is because there's so much misinformation about social workers and who we are and what we do, but that causes people to not value us for what we have contributed to society. And so what I want to do is just educate people more about who we are, what we do, and also give you a chance as a key member of NASW to talk about what NASW is doing to help us to elevate our status. So I want to start by asking you about the NASW's 2021 Blueprint for Federal Social Policy Priorities document. Tell our listeners a little bit about that.
So the National Association of Social Workers released this blueprint, which is 40 plus pages of recommendations that are actionable. The kind of audience for this actual document are the new administration, the Biden-Harris administration, and the 117th Congress. There are a total of 21 issue areas covered in the blueprint that really encompass our workforce, advocacy for social workers, and also those social justice priorities that benefit our clients and society. The blueprint's organized using the Grand Challenges for Social Work, which is a research-informed social policy agenda that the profession developed and that I served as the first executive director of that initiative. And so this is really I think, a foundational document that organizes the profession that we can get together and try to make progress in this Congress over the next 4 years.
Mm-hmm. Very good, very good. Now, we all realize, especially since the onset of the COVID-19 pandemic and also all the racial unrest and the political upheaval, we all realize now, and if not, we should realize how essential social workers are in the workforce. Why do you think, in your opinion, that we're not recognized that way?
Yeah. Well, some of the impetus for the reason for developing for the social work profession to embark on a Grand Challenges initiative was the fact that we're misunderstood as a profession. And I think some of the contributing factors is that we work across so many different settings, and in those settings, we have different scope of practice. And so we have social workers that are really providing services in schools, in hospitals, in community-based medical clinics, and nonprofits, even in public policy. We have social workers as members of Congress, which is
yes.
Okay. There are social workers who have dual training that are lawyers and also social workers, doctors, also social workers. So incredibly diverse field. And that leads to confusion because we don't just do one thing. And I think that it is the platform for which we should share about all the wonderful work that we do. But
yes,
it's true that we're misunderstood.
So one of the things that you and I have talked about, and I want you to elaborate on, is ways that we as social workers can advocate better for ourselves, and what's the importance behind that?
Yes. Well, you know, it's so interesting because we're living in this time of social media. I grew up without social media, and it's amazing because you can just kind of seemingly yell into the internet and you have a voice. So there's some power in the time that we're living right now, but we can't discount the importance of calling your member of Congress or their congressional staff or your representatives, your lawmakers in state legislatures, and saying, hey, I'm in your district, I'm a social worker, I'm a member of the National Association of Social Workers or any other social work organization that you're a member of, and explaining your experience. We need to be doing that on a routine basis and kind of asking for the things that we need or that our clients need.
Yes. I agree. I agree.
Start there. We can start
Okay.
there.
All right. And I think another key point that we as social workers need to consider, and I want to get your opinion on this, kind of going off script, but, you know, being able to access the media to tell our story.
Yes.
That's really
Absolutely.
important.
Yes, absolutely. So it's interesting, you know, decision makers often are not going to be the ones that are reading our research and our practice in journals. We do need to engage the media in a deliberate effort. And I do think that is a means to speed the translation of research to practice and policy. And that particularly our experts in the profession who they know quite a bit about the most vexing kind of social problems in our society, things like substance use disorder, how to treat very vulnerable clients, such as individuals who are experiencing homelessness, that they have ideas about how we could improve our social policies, and getting those ideas into the media, I think is critical.
Yes, yes, I agree. I agree. Now, there's a lot of talk going around about social workers having low, inequitable salaries when they start out in the profession, but at the same time graduating with high student loan debt. Can you share some of the data on loan debt and how that affects a person's decision to go into social work with those two factors impacting their decision?
That's right. Well, you know, it's amazing. Student loan debt has skyrocketed over the last 10 years. It's maybe even doubled for many different workers, for many different provider groups and other workers. So student loan debt, apart from the social work profession, is at a crisis level. But for us, it's really exceptionally difficult because of what you said, the low starting salary. So starting salaries are between around $47,000 and $50,000 for social workers that are trained at the master's level. So the terminal degree to practice social work is an MSW plus licensure requirements. Okay, and this can be a costly process, both in your education and what you need to do to pass the licensing exam and to maintain your supervision and continuing education. Amazingly, in social work, the amount of student loan debt is around $68,000 to $76,000 on average right now for a master's degree. That means that there's students in their profession that have much more student loan debt. And even more disturbing is that the Council on Social Work Education and the National Association of Social Workers conducted a survey recently of new social work graduates that shows even higher debt loads, with social workers of color having even more student loan debt than their white peers. And there, as you know, are many contributing factors. But the mean average reported by Black social workers in that survey data says 92,000. 92,000. And so if we think about having a starting salary of 47,000 and a debt of 92,000, that's about double.
Yeah, yeah.
Right. It's about double. So that's at a crisis level. And this is at the same time when we have a failed promise of public service loan forgiveness program that really has not been realized, that is now 10 years in, and majority of those applications are being rejected for forgiveness. And so we're 80% plus female in our profession. So that does suggest an unresolved gender pay gap. And we'll talk about this later, I think, in this discussion. But we're also one of the lowest paid provider groups in Medicare for clinical social work services, and this is contributing. So I think that this issue of women providing these services to vulnerable and underserved communities and not being paid is got to be our number one, number two, number three priority. There's different things that are right up there, but this is one of them.
Absolutely, absolutely. And that kind of leads me to the next point, for you to please talk to our viewers and listeners about advocacy. And when you talk about advocacy, NASW has been on the forefront of many, many issues. But also they had a big role to play in the Employer Participation and Repayment Act. Talk about that and what that means as part of the CARES Act in relations to NASW.
Yeah, this is interesting. So the Employer Participation and Repayment Act is a bipartisan bill from the 116th Congress that would benefit social workers and many other employees. It allows employers to contribute up to $5,250 towards their employees' student loan debt, and it's tax deductible to the employer and is not taxed to the employee. And this is an example where, social work wasn't mentioned in this bill. It wasn't really being advanced by kind of nonprofit or social justice groups. I found it trying to look for opportunities to support our profession around student loan debt relief. And we helped to work in coalition to get this bill enough support that the provisions were temporarily authorized through one of the COVID-19 relief packages, the CARES Act. And we want to advocate now to hold on to these provisions and make them permanent. And because we need a process, I think of this as some of the more innovative strategies where employers can contribute to the student loan debt of their employees. This is an important mechanism to support employees, to participate, and to retain them. Yes. So that's kind of one of the creative solutions that NASW members helped to get support for. We had over 2,500 members write to their lawmakers to get support for that bill in particular.
Mm-hmm. And there's also, as you and I discussed earlier, there's a real connection between the social work profession, or us as social workers as a specific profession, and the human services profession as a broader entity. And so the importance is that, we kind of all need to kind of do this together so that we can all kind of benefit the same. Now, social workers, one of the things that, and I just want to just add this, one of the things that I tell a lot of my colleagues, especially I speak to a lot of students that are going for their MSW, BSW, and I got this from one of my mentors: always state that you're a social worker, no matter what you do. If you do research, say you're a research social worker. If you do substance abuse, say you're a substance abuse social worker. Always put that in there, because what that does, in my opinion, is it gives the general public a broader view of all the things, the many different areas that we work in. But what I find is that somebody can be entitled a case manager or a caseworker, but not necessarily, they're not a social worker. But a social worker can be a case manager or a caseworker. So there was a time when they started grouping everybody together. And so now, we want to make sure we're clear on social workers, licensed mental health counselors, licensed marriage and family therapists. But when we talk about social work, we're talking about a very unique, specific, all-encompassing profession. And we do most of the treatment for mental health services. So can you detail efforts to increase clinical social work reimbursement rates in Medicare through the Improving Access to Mental Health Act? Why is that important, and how can that benefit the whole profession?
That's right. So, when you hear that title, the Improving Access to Mental Health Act, and you realize that the focus is on Medicare, you might not realize how significant support for this bill, what it would mean for our entire profession. And I'll try to explain that. What this bill would do, and I just say quickly that our champions are Representative Barbara Lee, Congresswoman Barbara Lee in the House, and Senators Debbie Stabenow and John Barrasso in the Senate. Without their support and leadership, we wouldn't have this legislation, so we wouldn't recognize them. And two social workers in Congress that are introducing this bill. So what the Improving Access to Mental Health Act would do was expand access to clinical social workers services in Medicare, specifically that those individuals in skilled nursing facilities could have access to clinical social work services. An example would be psychotherapy, to allow us to bill and provide services called Health Behavior Assessment and Intervention Services, HBAI services. These are services that are already within the scope of practice of social workers, but that Medicare doesn't permit us to provide in their program. And it would raise the reimbursement rate for clinical social workers from 75% of the physician fee schedule to 85% of the physician fee schedule. Now, why is this important? I'm not aware of any other provider groups that are being paid 75% of the physician fee schedule. Compares to psychologists, they are 100% of the physician fee schedule. Both psychologists and social workers provide psychotherapy services. The services are not identical, but there is a disparity in the reimbursement. And I just want to say that the reimbursement rates for many providers in Medicare are very low. So our most vulnerable older adults and individuals who are disabled, who are indeed Medicare beneficiaries, have a tough time accessing these services. And the reimbursement rate in Medicare has a big influence on what happens in commercial insurance and how they set their rates. And so when we consider the unbelievable mental health and behavioral health needs that have just been kind of highlighted through the COVID-19 pandemic, this is absolutely imperative that we don't have barriers to providing care, not just for social workers, but for all mental health and behavioral health. As you said earlier, if we want to really achieve parity where there's really robust access to these services, then we need to support all the different provider groups that are involved in serving our clients.
Yes, absolutely. A rising tide lifts all boats. Absolutely.
That's right.
Absolutely. That's right. Now, to get back to the whole concept, social work is seen and is a female-dominated profession. And I think that, we need to kind of really take a look at that, as you mentioned, because that has a direct impact on why salaries are so low. And that does need to be fixed, because for the simple fact that you also bring into the discussion, when you pay social workers such an unequitable salary based on the fact that most social workers are female, and the fact that when people hear the term social work, they tend to think of those who are less than desirable, the castaways, the write-offs. And so one of my colleagues said, well, people who are working with the poor, then they deserve to be paid poorly, which is the exact opposite. So the thing is that gender equity is wrapped up in this whole low pay scale, and that needs to be fixed. What is it that you think should be done and can be done to increase that part of the social workforce, which is female oriented, which is separate and apart? Because if you fix that, then you fix the salaries in themselves.
Yeah. Well, this is complicated. There's many contributing factors to why social workers, why there's a kind of history of not being paid as much as some other provider groups. Teachers may be another example, or nurses, and each of our respective disciplines have advocated and used different ways to kind of communicate this message. One of the challenges with our profession that we discussed earlier is the many different settings that we work in.
Mm-hmm.
So we almost have to have an approach where we're trying to raise the wages for clinical reimbursement for those workers that are in public child welfare, because they have a different employer. For school-based social workers, they have a different employer, the schools, the states, right? And so there are different points of advocacy to kind of lift those wages. And we're trying to do that across these different settings. I also think a dimension of this is that many social workers are indeed first-generation college graduates. It's something we don't talk about. It's something I'm very proud to share. I try to explain that in my work with congressional offices, that we are indeed one of the more diverse healthcare providers. Particularly our younger social workers, are individuals of color, are joining the profession, and these first-generation college graduates. And so they have a higher debt load because it's been so difficult for them to kind of transcend their social class and attain higher education, which is just amazing. And so it's something that I think our profession is actually contributing to society that we don't often talk about. But listen, I welcome ideas on how we can facilitate better understanding that we need to have a living wage. Unfortunately, there are social workers who even qualify for public benefits because their pay is so low. And I just want to say that it's also the case that social workers in some settings do quite well.
Yes, absolutely.
There are some social workers who make a very good salary, and some sectors of our profession, subsets of our profession, those jobs are more lucrative. And so sometimes social workers should look into that before they figure out what they're going to specialize in, what their practice is.
Yes, absolutely, absolutely. And the one thing that I noticed is that I was doing a radio program about 2 years ago, and I knew the host was going to ask me about it, about why social workers' salaries are so unequitable, and when you go into it, you don't really go into it. So I did a little research, and thanks to NASW's website, I found a slew of information that I didn't even know. And so I was very prepared. And when he asked me the question, so I said, well, listen, if you look at the social work profession, it's no different than any other profession. You come out of college with a 4-year degree. I said, you might start out, with the maybe 35, 40,000, you get your license, it bumps up. I said, but there are social workers, with some time and experience that can make 6 figures. And he looked at me, he goes, wow, I never knew that. So like you said, it's research and knowing what populations are in most demand, because it's supply and demand. If there's social workers in demand in a certain population, then that's something where you got to take a look at that. But social workers need to always be proud that they are social workers. It can't be something where they show deference to other professions, because as a profession, it's been said we're the most noble of the helping professions. And so one of my battle cries is, I say to all my social work audiences, I tell all the social workers to stand up, whether they're students or professionals, and I said, say it loud, say it proud. I'm a social worker and I make a difference. And so, we have to, we have to dispel the myth, because if we tell everybody that, we get paid low, then they're going to think that that's all we deserve to get paid. And then another thing that some of the research shows is social workers got to know what their intrinsic value is. So they go to school and get a social work degree, which is true. But what about all the other experience you bring to the table? So to be able to use that to parlay that and negotiate just like in any other profession. So I think, we need to know more of our worth, and we need to be able to advocate and sell that when we're at the negotiating table. And so that being said, the last point that I'd like to have you address is the fact that BIPOC communities are portrayed as the ones where social workers are most likely to be needed. Do you think that has anything to do with the salaries that are offered?
Yeah, it's hard to say. I do think that the populations that social workers have served over the years, and the extent to which society values these groups does contribute to perception and how much resources are allocated for certain things, right? So for just how do we value children? Many social workers focus on children and families. How do we value individuals as they age? How do we value certain communities over others? And so maybe there is some kind of impact of the populations that we work with, because the NASW Code of Ethics calls us to serve the community and underserved communities, and to have a focus on individuals who are not able to meet their basic human needs, right? But I actually think, Silas, that it is our strength that we are working in these communities, that we are among the community in our work, that we are providing social services, social work, right? And that's a selling point, especially now. So not only do we as social workers need to talk about our work, talk about the needs of our clients, but we need our clients in the communities that we serve to talk about the value of the social community.
Yes, absolutely.
And so I think this is our strength. Maybe in our history, it has worked against us, but I absolutely think this is our strength. And this is an area where we need to focus and try to facilitate those stories, the stories of our experience and of our clients, and the success.
The success stories, yes.
The success, and so, and particularly lawmakers, they like to hear from constituents in the community around these kind of experiences and what's working, what's not working. And I think that's a strength of social work. We go to the community. We try to do these projects that are bottom up, that are community engaged. And so may not be a complete answer to your question, which is quite complicated.
Yes, it is.
I'm trying to take the like a more optimistic way of thinking about this, see it as an opportunity.
Absolutely. Well, to add to that, I always, use my own personal life experience. Whenever I get the opportunity, I like to share that, because had it not been for social work, I'm telling you and everybody that's going to listen and hear this, I wouldn't be sitting here today as a licensed social worker with a master's degree and a father of 3 lovely daughters and a loving family. And that's not the background that I came from. So it was social work that rescued me from a very treacherous situation, not once, but twice. But before I was 3 years old, I had twice been rescued. And so when I'm out talking about social work, I'm talking from firsthand experience. And, that's why, I say that we need to get more people to tell the story of what social work has meant to them. I'm talking about successful people, because one thing I like to just add, before we wrap up, is our job is not to find somebody who needs public assistance and get them on public assistance so that they stay there. Our job is to get them solidly footed so that they can rise like a phoenix and go on to strive and thrive and then make a contribution to society. That's what social work does. It's not, people get the wrong idea, in my opinion. Your social work, all you do is help people get food stamps and you take people's kids away. No, that's not it. What we do is we change futures. And that's the story that I'm hoping that this documentary and individuals like yourself contributing can share with the viewers and the listeners, is that social work is a profession like none other. And once we get people to realize the impact, then it will be a no-brainer that they see that you can't put a price on what social workers do. You can't say it's worth this amount, because it's priceless. And I think that when we look at the big picture and we get more social work recipients to tell their story, then it'll change the narrative. But we got to get them to step up. So that's one of the reasons why I became an e-journalism social work advocate, to tell our story.
Yeah. No, I think you're absolutely correct that we need to get those stories out, and that they're very valuable. And we do have a lot to offer, especially in the policy space. And impact is what motivates me to do this work every day on behalf of our workforce and our clients. It's a great privilege. I also am kind of deeply motivated from my own experiences to do this work. And I think there's many passionate social workers in our profession that feel the same way.
Yes, absolutely.
Yeah.
Absolutely.
Yeah.
Okay, well, that's going to wrap it up for us here today. It's been my distinct pleasure to have with me a very distinguished guest, Ms. Sarah Butts, LCSW, who is the Director of Public Policy at the NASW National Headquarters in Washington, D.C. Ms. Butts, thank you so much for taking time out and talking with us and our listeners. We'll certainly get a lot from what you had to share, so thank you so much.
Thank you. Thank you for having me.
This is Silas, your e-journalism social work advocate and host of the show. You've been listening to the Kelsunn-on-the-Air Social Work Podcast. This and all other programs are available on the Apple iTunes, Spotify, and Anchor podcast platforms. Go to any search engine and type in Kelsunn-on-the-Air in the search window to hear this show in its entirety. Thank you for tuning in. This has been a Kelsunn Communications production.